Let's talk about 3 easy things you can do to help improve that lower back pain in the morning. We're going to talk about 3 things that I always tell my clients when I'm treating back pain and they're like, hey, my back feels awful in the morning. What can I do about it? We're going to go over those things today. My name is Dr. Michael Derry. I'm a concierge orthopedic physical therapist here in Jacksonville, Florida, and treating back pain is what I love to do. There's a lot of people out there that could use the help. So if you guys like this information, please subscribe and like the channel. Share it if you want. Provide some feedback. But today we're going to go over 3 easy things you can start right now to help improve that morning back pain. Let's not waste any time. Let's have some fun. Here we go. Okay, so the 3 things that we're talking about is number 1, stop sleeping on your belly. When you sleep on your belly, your spine is in more of a closed off position, a little bit of an extension position. And while some people have slept on their belly their whole life and feel completely fine, that's not the case with most of my clients. And so when you sleep on your belly, it's a little bit closed off in the spine. It's normal range of motion for the joints, but it can feel a little stiff and achy, especially if you're the type of person that when you stand or walk for a long period of time, you have back discomfort, or when you try to go arch backwards and you have back discomfort or pain. And so when we're talking about stiffness in the morning, if you're sleeping on your belly, you've got to switch to your side or some other position. That's just a no-brainer. It's a low-hanging fruit. The other 2 things be, 1, you got to do some stretches before you go to bed and mobility work, and you've got to do mobility work when you first wake up in the morning. And if you don't know what mobility work is, we're going to cover that in just a second. But when you do those 3 things, morning stiffness can feel a lot better. I'm the type of person that I would rather you incorporate those 3 easy things rather than going to spend a ton of money on different types of pillows and stuff like that. And so I want to show you my favorite little routine to do before bed and when I wake up in the morning to help with some of that early morning stiffness. We're going to go over the form, we're going to go over how it should feel, we're going to go over the technique and other things that I've just tips and tricks that I found over time to help improve some of that stiffness. Let's have some fun. Here we go. So stiffness is really interesting, and that stiffness is 100% perceived. It's how you feel. We can't really measure it. We can't really be like, oh, you're stiff. There's no gold standard. Like, there's nothing to compare it to. It's not like saying you have this amount of strength in pounds you can lift. We can't measure it. And so stiffness is all about perception. It's how it feels to you. So keep that in mind as we're going through this mobility work, and that it's very unique to your body. You want to listen to your body, listen to the cues that I'm saying, but also understand that everybody's body is built differently. And so mobility work, and what I explain to my patients is that some people think when they do morning stretches or before they go to bed stretches, that the stretching needs to be a prolonged hold and we're focusing on muscle. Well, when we take a step back and improving mobility of your spine, we look at what contracts, which is muscle, and what doesn't contract, structures such as like your disc and the joints in your back. And then when we do mobility work, we combine to those things. And so improving the mobility of the joints in your back and the musculature around it, or at a 15,000 foot view, when we look at things that contract and help you move and the things that help control that movement. And so we're looking at all of that. And so that's mobility, is that we're going to go through bigger ranges of motion, but we're not going to hold it and try to stretch the muscle. And we're also not going to go super fast either. We're going to help improve the joint mobility, help nourish those joints with some good articular fluid, and just get you feeling better without doing the prolonged hold of traditional stretching, but going through very normal ranges of motion of the spine. And so the barriers that people tell me is when they try to do this stretching, it's either they don't know how to do it and what it should feel like, so we're going to address that stuff, or they don't have time to do it. So we're going to make it very brief. We're going to make it very, very quick, but help go through some traditional ranges of motion of your spine to help improve global mobility deficits or stiffness. And so if you have that morning stiffness and you want to get rid of it, stop sleeping on your belly and do some mobility work before you go to bed and when you first wake up in the morning. Let's go over some of my favorite things right now. To be brief, we're going to go over 2 easy little things that we could do. And I'm going to tell you exactly what it should feel like, okay? So I'm going to start getting into the position now, and you're going to want to lay on the floor or in your bed. We're going to work on normal ranges of your motion of your spine. That would be flexion and extension, and then rotation as well. So we're going to work on all of those. The first exercise here is called a thoracic rotation or lumbar rotation. You're going to lay on your side. Make sure your knees are bent way up. You're going to lock that top knee down with your hand that's closest to it, and you're going to open up this way. Oh, so this is the rotation. Remember when I was talking about mobility, that we're not holding it, we're just opening up. And so what you're gonna notice here is that as I'm reaching, I'm kind of pulling down with this arm here. Oh, it feels really good, that rotation. So what it should feel like is you're just feeling things stretch. It's not really a muscle stretch in that these muscles are pretty small in your trunk. It's more of a joint stretch. So I'm relaxing, and to level that up, you're gonna breathe out. This does not take long. We're talking 5-6 reps on each side. Now, ideally, I'd like to get 10 or 12, but hey, if you have 5 minutes before bed, you've got a busy life, this is what I would do. The rotation on both sides. So we just hit one side. I'm gonna sit up, hit the other side. You can have a pillow underneath here, of course. Lock those knees down and then rotate. Gosh, my left side is a little sticky today. Rotate. I'm forgetting to breathe. You gotta breathe out. So this is rotation of the spine. And when you might feel a little glute stretch too, ooh, I just got a little pop. That's completely normal. This stuff is completely safe for those who have a history of arthritis, degeneration, disc bulges, etc., etc. We're gonna dive through that. Okay, there's those 5 reps. Remember, I told you we're gonna be brief. Whew. All right, so now we have to work into flexion and extension of the spine. And so that is more, this would be extension, kind of poking the butt out, and this would be flexion. So my favorite way to do this would be going down into a press. You're gonna press up, and then you're gonna come up to your hands and knees, and then sit your butt down. And what this is doing is it's hitting all of it. Press up. We're gonna hit 5 reps here, and then come back up and press down. Now, if you can't do that, that's completely fine. You could just do the cat camel. You can curl and poke. But if we're talking about being brief but effective, this is what I would do. I would do the press up, I would come down and go right into the prayer stretch or child's pose. Press up, right back up and down, child's pose. We'll do one more. Remember, it's mobility, right? So you can tell we're not doing a static hold. We're just moving right into the mobility of the spine. So there we go. So we hit rotation, flexion, and extension. And tell me how your spine and hips feel right now. And doing that little routine before you go to bed and when you first wake up in the morning can start you off feeling so much better and not have to worry about changing your mattress or even worried about going to stay at a hotel, right? You don't know what kind of bed you're gonna stay in, but help improving your mobility of your spine. That's a great way to do it. Do that for a week or so and see how you feel. And guys, if you like the content, please subscribe to the channel, consume more. I put a lot of stuff out there about regarding back pain. But guys, stay healthy, keep moving, and take care of yourself.